55-year-old woman comes to the clinic for a routine checkup. She has a 1 year history of hypertension, but physical examination is otherwise unremarkable. The physician recommends screening for diabetes, including a fasting blood glucose and HbA1c test. Is overweight and has a family history of type 2 diabetes. The patient declines, saying, I don't feel any symptoms and I really dislike having blood drawn. Which of the following is the most appropriate response by the physician? Choice A, you can make your own decision, but I recommend the blood test because early diabetes is common and often has no symptoms. Choice B, we can skip the test if you want and just continue monitoring your blood pressure. Choice C, since you have no symptoms, we can skip the test for now and we can check how you're feeling at your next visit. Choice D, I strongly recommend you get the test done since your weight and family history put you at great risk at developing type 2 diabetes. Or choice E, don't worry, you won't feel a thing when we draw your blood. I'll wait 5 seconds and answer this question. So here's another ethics question, and as usual, a lot of it is just EQ. But as far as principles go, obviously this one is testing on autonomy mostly. And of course, you also need to make sure you are properly informing the patient while respecting their autonomy. So only choice A, you can make your own decision, but I recommend the blood test because early diabetes is common, often has no symptoms, is the correct answer. Now, choices B and C also respect their autonomy for the most part, but it's clear for both of them you're not really properly informing the patient. And choice C is just misleading because it's implying that being asymptomatic means that you're not at risk for diabetes, but type 2 diabetes can be asymptomatic at first. And I guess a quick note there is that sometimes if they want to make ethics questions harder, they do give you answer choices where you say something that sounds reasonable from an ethics perspective, but it's just medically incorrect, right? And obviously, those would be wrong answers because you're not allowed to mislead patients. Choice D is factually correct, but clearly it's a little bit paternalistic and you're kind of threatening the patient almost because you're saying that they have all these risk factors and it's best for them that they get the test done, which is technically true, but you can't really threaten patients that way. That's not really a good answer choice for ethics questions. And choice C is just straight up a lie, right? We haven't invented magic needles that don't feel painful on some level. Not yet, anyway. Again, not a hard question like most ethics questions, but sometimes you just need to get used to doing them. I hope you found this video helpful. I'll see you in the next one.